A number of the measures that we're announcing today, including a cap of 300 on any major venues, including the fact that if your venue has capacity for more than 250 people, there will be a full-time marshal on duty at all times to make sure the COVID-safe plans are being implemented. For venues that are less than 250, there will be a COVID-safe person there during those peak times when the venue is operating. And of course, the industry will also be mandating taking every single person's detail, and where possible, I know the industry is also working to make sure all of it's done electronically to allow for clarity and legibility and quick information. So this is a good example of industry and government working together to reduce the risk during a pandemic. Whether we like it or not, the reality is that life is not normal, and it will not be normal until we have a vaccine or a cure. Life will not be normal during the pandemic, and so the question we ask in New South Wales is, what can we do to reduce the risk, to reduce the spread, so that we continue to have a good level of activity in our community, a good level of people staying in their jobs and going about their business. So what New South Wales is always looking for is opportunities to reduce the risk, and we know from the health experts what that risk is. It is mainly indoor venues with a number of people that are more likely to transmit the disease, which is extremely contagious, as we all know. But there are also a number of other things that go into the COVID Safe Plan, which the industry now will be making mandatory, not optional. Registration will be mandatory, not optional. And of course, these additional measures will reduce the risk that if there is another situation where there is transmission, and we hope there isn't, we hope there's prevention. But we also know, and I want to make this point very clear, that during a pandemic, when you're easing restrictions, as we have been doing, you're going to get extra cases, and we have to live with that. There is no way that New South Wales will have zero cases during a pandemic. It's not going to happen, and we shouldn't expect that. We are always going to have cases when we've eased restrictions, and all of us have to accept that. But the reason why we are especially in high alert in New South Wales is also, of course, of what's happened in Victoria. The proximity, the geographic proximity of our states, the fact that there were some challenges with quarantine, potentially going back some months, means that we have that risk that there's been that level of community transmission in New South Wales for some time, which is why we are on extra high alert. And there will be phases during the pandemic when we are more concerned than other times. And this is the time that we are more concerned, because we are still tracing what level of community transmission has occurred in the last few months that may be bubbling below the surface that we're not aware of. So what our aim is in New South Wales is to reduce those activities that have risk, and I'm deeply grateful again to the AHA for working with government. This is a good example of industry taking the initiative, coming forward and working with us to provide a COVID-safe way of moving forward.